Good afternoon. I'd like to call this meeting of the Committee on Health to order. Today is Tuesday, December 12th, 2023. The time is now 12:05 p.m. I'm at-large Councilmember Christina Henderson, Chair of the Committee on Health. I want to note the presence of a quorum. Council members Vince Gray from Ward 7, Councilmember Charles Allen from Ward 6, and Councilmember Brianna Doe from Ward 1. We have a quorum of the committee. Today, we will consider 8 measures before the committee, including 3 nominees for Health Licensing Board, 1 nominee for the Food Policy Council, the nominee for the Food Policy Council Director, and then 3 bills. I'm going to start with the nominations. The mayor has nominated 3 individuals to Health Licensing Board, 1 to the Board of Marriage and Family Therapy, and 2 to the Board of Dentistry. PR 25-502 nominates Sheila Holt as a licensed marriage and family therapist, member of the Board of Marriage and Family Therapy, for a term to end February 5th, 2026. Ms. Holt is currently the chairperson of the board. She has a private practice and expertise in play therapy, suicide prevention, and adoption. Ms. Holt also serves as a senior ambassador for the Department of Aging and Community Living and teaches at Trinity Washington University and the University of the District of Columbia. Ms. Holt holds an MA in counseling from the University of the District of Columbia, and she is a Ward 5 resident. PR 25-503 nominates Dianne Smith for reappointment as the consumer member of the Board of Dentistry for a term to end November 30th, 2024. Ms. Smith is a retired attorney with over 40 years of experience practicing law in the district and 15 years experience serving as Associate General Counsel for Howard Hughes Medical Institute in Chevy Chase, Maryland. Ms. Smith earned her Juris Doctorate degree from the University of Wisconsin School of Law, and she is a Ward 2 resident. PR 25-532 nominates Brittany Harris for appointment as a licensed dental hygienist member of the Board of Dentistry to serve for a term ending November 30th, 2025. Ms. Harris has been practicing dental hygiene since 2013 and recently transitioned into dental hygiene education at the University of Maryland School of Dentistry. Ms. Harris is a member of the American Dental Hygienists Association and the American Dental Education Association. She earned her Master's of Science in Dental Hygiene from Old Dominion University. Ms. Harris is a Ward 7 resident. At this time, I'd like to open the floor for discussion of the 3 nominations for the health licensing boards. Okay, hearing none, I will now move the committee prints and accompanying committee reports in block for PR 25-502, PR 25-503, and PR 25-532, with leave for staff to make technical changes in consultation with the Office of General Counsel. All in favor, please say aye.
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 All opposed? All right, let the reflect that we had a unanimous vote for those 3 nominations. I will now move to the DC Food Policy Council nominees. The Food Policy Council advises the Food Policy Director, the Mayor, and the Council on promoting food access and sustainability, supporting local food businesses and entrepreneurs, and improving nutrition and health for district residents. The FPC submits an annual comprehensive report regarding the state of the district's food system, suggesting policy changes and identifying funding priorities. Additionally, the FPC seeks grants and funding for food policy and programs in the district. PR 25-529 nominates Caroline Howe as the DC Food Policy Director. As the Food Policy Director, Ms. Howe would lead the Food Policy Division at the Office of Planning, which provides strategic direction and guidance to the executive on food policy priorities in the district. She would also lead the Food Policy Council and collaborate with district agencies and community leaders to achieve the food policy council priorities. Ms. Howe joined the Office of Planning as an acting food policy director in June of this year. Prior to this role, she worked in several district agencies. At the Department of Small and Local Business Development, she led the Food Waste Innovation Grant Program and the Aspire Program for Entrepreneurship for Returning Citizens. At the Department of Energy and Environment, she coordinated the implementation of Sustainable DC 2.0 and served a detail at the COVID-19 Emergency Operations Center focused on expanding grocery access. And at the University of District of Columbia, she taught food and farm entrepreneurship courses. Ms. Howe holds a master's in city planning from the Massachusetts Institute of Technology, and she is a Ward 4 resident. At her confirmation hearing, I asked her about how she could help the executive better coordinate between the agencies. I was impressed that in her first 5 months, she has already brought together DEMPED and DOEE to apply for a large federal grant for local food businesses and has facilitated the planning between DHS and OSSI to implement the summer EBT program. She has also brought on new ex officio members to the Food Policy Council from DGS and the Department of Licensing and Consumer Protection. I believe Ms. Howe is uniquely qualified to take on this role, and I look forward to working with her toward our shared goals. PR 25-399 nominates Jose Funk McDonald Morales as a public member to the Food Policy Council. Mr. Morales is currently the Vice President of Sales for DC and Northern Virginia for Keeney Produce Company. Through Keeney's Executive Leadership Development Program, Mr. Morales has moved up through the organization since he started as a customer care representative in 2012. Mr. Morales' experience in local food systems also includes serving on the board of Fresh Farm, the largest farmers market district, and working at several farmers markets and local food companies in California. He is a Ward 5 resident. At this time, I'd like to open up the floor for discussion on the nominations for Caroline Howe as Food Policy Director and Jose Funk McDonald Morales as the Food Policy Council member. Okay, hearing none, I will move these nominations in block unless any colleagues object. So I move the committee prints and accompanying committee reports for PR 25-399 and PR 25-529 with leave for staff to make technical changes in consultation with the Office of General Counsel. All those in favor, please say aye.
Aye.
Aye. All right, let the record reflect that that was a unanimous vote of members present. Now we will turn to 3 bills before the committee. All right. Bill 25-321, the Home Visiting Services Reimbursement Amendment Act of 2023, was introduced on June 9th, 2023 by Council members Nadeau, Louis George, Robert White, Parker, and Allen. This legislation will require Medicaid and the DC Healthcare Alliance and the Immigrant Children Services Program to cover and reimburse eligible evidence-based home visiting services beginning January 1 of 2025. The district's Department of Healthcare Finance would be required to consult with home visiting providers in the district to establish eligibility criteria and reimbursement methodology, and to submit an amendment to the district's Medicaid state plan to the CMS by December 31st, 2024. Home visiting services vary across provider organizations, but in general, the model includes services to support expecting parents, new parents, or legal guardians with infants, toddlers, or children up to 5 years of age. Home visiting services are provided by a trained professional in the participant's home and include individualized and culturally competent health, social, and educational services through weekly or monthly home visits. Home visiting has been evaluated in more than 30 years of academic research studies, which have shown that home visiting can reduce child abuse and neglect, behavioral and intellectual problems in children at age 6, criminal convictions of mothers, unemployment for mothers, hypertensive disorder of pregnancy, preterm births and low birth weight babies, as well as improve school readiness for children. The council has recognized the importance of home visiting services and provided a grant to support this through the budget for the last several years. Thank you, Councilmember Nadeau. The bulk of the grant funding for the home visiting has been housed at DC Health, but in fiscal year 2024, the council moved some of this funding to the Department of Healthcare Finance to begin the transition of home visiting services to be funded through the Medicaid program. To date, 30 states have implemented Medicaid coverage for home visiting. 7 more states are awaiting approval from CMS. This legislation would have the district join the majority of states in supporting these important services that support families during pivotal periods of pregnancy and early childhood development. The committee print does make several changes from the introduced version. First, to address healthcare finances concerns regarding time necessary to consult with stakeholders in development implementation plan, the committee postpones the implementation to January 1 of 2025 for an effective date for coverage. Second, the committee print incorporates more guidance from the Department of Healthcare Finance when establishing eligibility criteria, requiring that they cover at least first-time expectant parents and expectant parents who have children under the age of 5 and who meet 3 or more medical, behavioral, or social risk factors. This change will set a minimum requirement so that at least this target covered population is covered, but Department of Healthcare Finance has the full authority to expand coverage beyond this defined population. I would like to note that the committee print is also renamed to the Home Visiting Services Reimbursement Amendment Act of 2023 under the advisement of the General Counsel. At this time, I'd like to open the floor for discussion on Bill 25-321. Councilmember Nadeau.
Thank you so much, Madam Chair. Earlier this year, I introduced B 25-321, the Home Visiting Services Reimbursement Amendment Act of 2023, because I strongly believe in the effectiveness of evidence-based home visiting programs. And I think it's incredibly important that we enhance access to such services in the district. As a mom of two, like you, I understand how overwhelming it is to bring home a new baby. Our home visiting programs ensure that new mothers and the parents of young children and toddlers will have access to services that are critical to mother's health and the health and development of their children. Research shows supporting new mothers and mothers of young children has short and long-term impacts that help families provide a nurturing and healthy environment for their kids. Children's experiences up to the age of 5 are critical for their foundational development. During this time period, they develop cognitive, language, and literacy, emotional, and reasoning capabilities. When infants and young children deal with poverty or other toxic stressors, it has a detrimental impact on both their short and long-term development and leads to lifelong health disparities. Evidence-based home visiting programs that engage expectant parents and provide parental coaching and guidance, in addition to helping them access other professionals and services, are among the most effective interventions available to alleviate the stressors of poverty. For example, Nurse Family Partnership, which I brought to the district through previous legislation, provides home visiting services to first-time mothers and has found that their services have seen great results with respect to lowering rates of child abuse and neglect, as well as behavioral and intellectual problems among children of program participants, while at the same time lowering rates of pregnancy hypertension disorders among mothers in the program. Each year, we hear advocacy for more funding for home visiting programs, and I've worked to ensure and increase the funding available since my time as chair of the Committee on Human Services. But ensuring coverage for home visiting services under Medicaid, DC Healthcare Alliance, and immigrant children's programs would make these services available to far more parents. In particular, accessing Medicaid dollars allows us to stretch local funds to ensure that mothers in the district can benefit from these services. At least 20 states' Medicaid plans include home visitation coverage, and I'm hopeful the district will be added to that list. Thank you, Chairperson Henderson, to you and your staff for moving this bill quickly and improving it for better implementation through your committee. I look forward to voting in favor of this important legislation today. Thank you.
Thank you, Councilmember Nadeau. Does anyone else have any comments on this legislation? All right. So I will now move the committee print and accompanying committee report for Bill 25-321, the Home Visiting Services Reimbursement Amendment Act of 2023, with leave for staff to make technical changes in consultation with the Office of General Counsel. All in favor, please say aye.
Aye.
Great. Let the record reflect that was a unanimous vote. The next bill is Bill 25-419, the Childhood Continuous Coverage Amendment Act of 2023, which was introduced by myself, Councilmembers Pinto, Robert White, Nadeau, Allen, Parker, and Louis George. This bill would require that any child enrolled in Medicaid and the Children's Health Insurance Program or the Immigrants Children's Program during the ages of 0 to 5 years old would not face a redetermination or risk losing their health insurance coverage under the program until the end of the month in which they turn 6 years old. During the COVID-19 pandemic public health emergency, all Medicaid enrollees were continuously enrolled. Redeterminations of eligibility resumed for Medicaid enrollees on April 1st, 2023. As of November of 2023, the district has seen tens of thousands of individuals removed from the Medicaid rolls. Nationally, more than 7 million individuals have lost their coverage, including more than 2.8 million children, due to the recertification process. For many, the loss in coverage was not due to ineligibility, but due to paperwork. This bill would reduce the worry and stress associated with the potential of losing health insurance coverage for children and provide many health benefits. Continuous enrollment promotes health equity by limiting the gaps in coverage for low-income children who frequently experience health disparities. Additionally, continuous coverage improves access to healthcare services, including preventative services, assists with care coordination, and allows for consistent treatment over time for chronic conditions. In passing this bill, the district is growing a growing movement of states over the past year who have passed or have pending legislation to provide children with continuous coverage. Just in the 2 months since our hearing on this bill, 4 additional states have already applied to CMS to provide continuous coverage. The committee print makes only minor changes from the introduced version, including clarifying that the reason for the redetermination may be conducted. The committee print also makes the legislation amendatory, and therefore the act is now titled the Childhood Continuous Coverage Amendment Act of 2023. At this time, I'd like to open the floor for discussion on this bill. All right. Hearing none, I'll move the committee print and accompanying committee report for Bill 25-419, the Childhood Continuous Coverage Amendment Act of 2023, with leave for staff to make technical changes in consultation with the General Counsel. All in favor, please say aye.
Aye.
Aye. All right. Please let the record reflect that was a unanimous vote. And one last bill. So I reintroduced Bill 25-463, the Minor Access to Medical Records and Appointments Amendment Act of 2023, along with council members Bonds, Robert White, Alan Parker, Louis George, and Pinto on September 18th, 2023. The bill was originally introduced as Bill 24-231 with the same name in April of 2021 and referred to the Committee on Health. There was a hearing that was held on November 15th, 2021, but the bill was never marked up. This bill would increase privacy for youth 16 years old or older and encourage them to seek primary care services when needed by making it easier for them to independently access vital medical records and schedule medical appointments. In the District of Columbia, there's a substantial number of 16 and 17-year-olds that have little to no adult support due to homelessness, shifts in foster care, or other circumstances. In developing this legislation, I work very closely with the DC Girls Coalition, a youth-led organization that works to elevate the voices of young women, girls, femmes, nonconforming, and young women/girls of colors of trans experience in the District of Columbia. The DC Girls Coalition reported that many of the youth they serve are not able to make medical appointments for themselves without parental consent, or have had to wait weeks or months for their caseworker to coordinate their health appointments. Currently, DC law allows for a minor over the age of 12 who is deemed capable of providing informed consent by a doctor to seek certain medical services, including pregnancy or its lawful termination, substance abuse, including drug or alcohol abuse, and a mental or emotional condition or sexually transmitted disease without parental consent. However, the law is unclear as to whether parental consent may be required to actually schedule such appointments or request medical records that would inform a provider's decision-making. The committee print makes several changes to the bill as introduced based on testimony from the public and DC Health at the hearing and further conversations with DC Health and the Department of Healthcare Finance. First, the committee print limits the scope of the bill to only cover youth who are enrolled in Medicaid or the DC Healthcare Alliance. Youth enrolled under their family's private insurance could unintentionally incur a coinsurance or a copay cost for their family if they seek medical care without parental consent, potentially leading to medical debt for the family. Given that 3 and 7 children in the district are covered under Medicaid or the Alliance, and that the intent of this legislation is to primarily support the children who are homeless in foster care or otherwise not supported by a legal guardian, the committee believes that the committee print will cover all intended youth. Second, the committee print clarifies that the bill only authorizes youth to seek primary care medical services, including dental or vision health services, and does not include specialists, emergency care, or surgery. This provision is based on DC Health's testimony at the hearing, in which the agency expressed concern about youth seeking advanced medical care without adult supervision. I would like to note that under the advice of General Counsel, the name of the bill has been changed to the Minor Access to Medical Records and Appointments Regulations Amendment Act of 2023. At this time, I'd like to open the floor for discussion on this bill. Hearing none, I will move the committee print and accompanying committee report for Bill 25-463, the Minor Access to Medical Records and Appointments Regulation Amendment Act of 2023, with leave for staff to make technical changes in consultation with the General Counsel. All in favor, please say aye. Aye.
Aye.
Great. Let the record reflect the unanimous vote. This concludes today's Committee on Health meeting. The committee has a hearing tomorrow, and then we also have a hearing on Thursday. The time is 12:25, and this committee meeting is adjourned. Thank you all very much.